A back or neck injury doesn't always lead to surgery. There are other options, and in many cases, there are non-surgical treatments that can alleviate the discomfort. The key is early treatment. Here with us today to help explain some of the non-surgical treatments is Dr. Anthony Leone. Thank you so much for being here.
Thank you.
I've already quizzed you about so many of the different things because I find this fascinating because so many people I know have back pain. What's the problem? What's going on?
Well, the number 2 reason that patients will end up in a physician's office is back pain, number 1 being upper respiratory infections, but it is the number 2 reason for doctor visits in the United States. And back injuries can come from many different aspects of employment, and a lot of times back injuries just occur from everyday wear and tear on the spine.
What are some of the common spinal problems that you're treating?
A lot of what you see in everyday spinal care is degenerative problems. By the time you reach the age of 40, most of the population has some wear and tear of the discs in your neck or your back. In this model, these little blue areas represent the discs. A good portion of your disc is water. Water on an MRI appears white. So if you look at a person's MRI, 50% of people over the age of 40, the discs will look dark, meaning that they've lost their water content and they become dehydrated. Some people have no symptoms. Some people can get very severe symptoms. If the disc is dehydrated, it makes the disc more susceptible to herniation.
And this is a healthy spine?
This is a healthy looking spine,
All right, so somebody comes in and it just seems like if you've ever had back pain, you know what I'm talking about. If your back hurts, you just want to get fixed and you don't care what it takes, please just fix my back. But you take a pause and talk to the patients and work non-surgical ways. Yeah,
I think that when you look at the surgical options, doing surgery on someone's back or neck isn't like having a knee scope or a shoulder scope where you go home the same day and the recovery is pretty quick. I mean, some back surgeries are extremely long as far as the rehabilitation is concerned. There are possible complications, and not everybody has relief of their back pain. Patients with leg pain oftentimes have a much higher success rate. In cases where patients have a lot of pain down their arm or down their leg, it's because something is pinching the nerve. If you remove the object or entity that's pinching the nerve, oftentimes you can eliminate the pain.
And it's also important if somebody's suffered the back or neck injury to seek treatment early. Tell me why.
I think that when you start the path to trying to improve your situation and trying to heal, you want to start on the right path from the get-go. A lot of people think that just resting and staying in bed for a long period of time is good, and over time we've realized that that's actually not a good thing, because the more you rest, the higher the chances are that you're going to weaken your back and actually make the problem worse. So early mobility and early physical therapy exercises and things of that sort is important. We usually get people started on exercises as quickly as possible, but we also try to control their pain with judicious use of medications without using medications that are too sedating.
You've talked about a couple things that I've never even heard of, the patches and the creams that help, relieve pain right away. That's very interesting. I want you, though, to hit on the fact that if somebody has a back injury, they can come right to your office and get looked at. How does that work?
What we're doing is we're trying to reach out to the immediate care units, urgent care centers, and the ERs, and I'm planning on speaking to most of these people in person. ER doctors are busy. You go to an ER, you have to wait sometimes hours. The ER doctor does not need to spend time trying to call an office to set up a follow-up appointment. So what we're trying to do is to make things easier and to get the patient's treatment started earlier is they can just give them the card to my office and tell them just go to his office the next morning. No appointment necessary.
That's amazing. Well, it was so nice to meet you. Thank you for coming on your first time on Western New York Living. I appreciate that.
Thank you for having me.
If you or somebody you know is suffering from a neck or a back pain or injury, Dr. Anthony Leone can help treat your particular condition. Give them a call. You'll get personal attention that you deserve and the solution that best suits your lifestyle. Dr. Anthony Leone, located at 192 Park Club Lane in Williamsville. Give them a call at 716-66-SPINE or visit them online at spinesurgerybuffalo.com. Well, that's all for today's show. Be sure to join us next Saturday morning to find out more about what's great about Western New York. We'll see you next week. Have a great day. Bye-bye.
Special consideration for today's show paid for by the following: